Well, good morning and welcome everyone to this CDA quarterly all stakeholder meeting. Thank you for being with us. I'm Adam Willoughby with CDA's Office of Legislation and Public Affairs. Before we begin, I'd like to briefly highlight the topics that we'll be covering today. You'll hear updates on COVID-19 response activities, including how our aging and adult services programs are evolving to provide services in new and different ways. Public information and assistance activities, master plan for aging, aging-related legislation, recent appointments, and departmental updates. There will also be an opportunity for questions, but until then, participants' lines will be muted to reduce background noise. When we get to the Q&A section of the agenda, use the raise hand icon in the bottom left of your screen, or if you're calling in on a phone, you can press *9 to request your line to be unmuted. An archive of this presentation, along with the PowerPoint, will be made available later in the week on CDA's website. We will share out the link on our Twitter, Facebook, and LinkedIn social media accounts. So thank you all again for being with us. And at this time, I will hand it over to CDA Director Kim McCoy-Wade, who will lead us through the agenda. Kim.
Thank you, Adam. And thank you to that looks like close to 150 people who have joined us. Today, we are very proud to provide a round robin of updates on the work we've been up to and also be very clear about the work that remains ahead. Before we jump in, I just want to, in reviewing and preparing for this, was just so moved by all the partnerships, and we'll be lifting up all the people and organizations who have been partnering with the CDA in some longstanding ways and some new ways to really drive all this work forward. But let's dive in so we can get to Q&A. And of course, let's start where we must and always will, COVID. This, of course, is driving and focusing all of our work right now. And we'd like to talk about it from three different lenses. The numbers. I think we all know, and to our colleagues at CDPH, that older adults continue to not have the most cases. Next slide, please. But have the greatest lethality, the greatest deaths of older adults, 60, 70, 80, 90, and 100. We know that people in congregate settings, older adults, people with disabilities, healthcare workers also have higher deaths. And of course, we are seeing disparate and discriminatory death rates among Latino, some API, Black, and Indigenous communities. So the data is, while in a better place at the moment, we are all doing all we can to promote the best practices in infection control and in staying healthy, staying safe, and stay connected. So these numbers are top of line. And just to say more, of course, behind every number, next slide, is a story. And we are well aware that so many of us have lost lives of loved ones, friends, family, colleagues. I don't think a day goes by where we're not hearing from whether it's the Long Beach Mayor, Robert Garcia, or Senator Tony Atkins, who've lost family members, and so many of you. So we have a page here where we have the numbers and a place to remember those who have died. And also we are assembling their stories. The Chronicle, the LA Times, many of our California journalistic leaders have done in-depth looks at long lives cut short. And so we are adding those stories as we have them. If you have suggestions for other ways to remember all of the folks we have lost in California and miss and honor, please do send our way. So that powers us and drives us to respond. And we're very lucky to have the federal partnership. First, right out of the gate, the Families First response funds, and second, the CARES Act, Coronavirus Aid, Relief, and Economic Security. What you see on the slide are the dollars, the total dollars that came to California, to CDA for aging services, the amount that has been dispersed for local direct services. And then in some new work we're doing is pooling money to work on shared initiatives. So we'll talk about some of those in the coming slides, but some of you may already be aware of the Friendship Line. And that's one of the examples of how we are pooling funds to provide statewide services stronger together. So you'll see that the Families First money is fully out. The CARES money we are dispersing in partnership with AAAs as they spend and need and request more. So a significant amount is out and on the ground, and more continues to be dispersed as requested and needed. Okay, so those are the numbers, those are the dollars. What are we doing with all of this money to meet the need? And one of the things we did, we knew we wanted to measure in a person-centered, data-driven way. So let's talk about our aging and adult services. You'll see on the next slide, we have a range of initiatives and programs at CDA, but we wanted to stand up for the COVID response, a rapid response data dashboard to do our best to track in close to real time the impact of our services and our network's work. To be clear, this is not replacing the formal official reporting to federal government and state government. And we will do more going forward to integrate that. But this is a way to keep a dashboard in front of us of how we're doing. So you'll see a couple shots of that as we go forward. And of course, it's on our website on the COVID page. Person-centered, data-driven, and continuous improvement. It's different than it was 3 months ago, and I promise it'll be different again in 3 more months. Today, I want to start in talking about our services with our Ombud services, because this has been an incredible focus of the last quarter since we last talked in July. Our priority has been to help and empower and support our long-term care ombuds to re-enter long-term care facilities and be there in person to provide their essential services, eyes and ears. Of course, they have been, their services have continued since the outbreak of COVID through telephone and virtual, but we all know that in person, there's no substitute. And when we can do that safely, we ought to do that. So the Ombudsman, led by, of course, Joe Rodriguez and his team of staff have led an effort on reentry the last quarter. And here's one of our partners. We were able to convene an ad hoc group with Nicole Howell, local long-term care ombuds from the East Bay, Susan Damaris from Alzheimer's Association, Molly Davies, long-term care ombuds from LA County, and Lisa Coleman from the Long-Term Care Association, and Carrie Graham, a master plan for aging consultant from UC Berkeley and UCSF, to really, this work group put the work in work group, really work with the guide to develop guidance that went out in September about how to re-enter safely, to work in partnership with CDPH on briefings, technical assistance, training, PPE, to help ombuds enter safely. And if you look at the next slide, you can see where we are. So this time last year, there were about 4,000 facilities visited in October 2019. Visiting in terms of people, about 6,700 people. You see the number 6,723. Right after COVID, those numbers precipitously dropped down to 164 facilities visited and 299 people visited. We knew we needed to rebuild as safely and quickly as we could. And I want to commend our ad hoc work group, set a very bold goal in early August of, can we do 1,000 visits can we way? And I want to give them full credit. Facilities 909 achieved, so a long way to go to get back to 6,723, but we are on the way. So thank you to all who worked so hard and continue to work so hard on that. Now let's turn to our home and community-based services, which are multifaceted. Our biggest and most well-known program, of course, is our meals. We traditionally work with our local partners on both congregate meals, like you might see at a senior center, or the Meals on Wheels or other home delivery programs. And of course, with the COVID, all went delivery, all went to safe, and that flexibility continues. We always want to remind people that you can call your local area agency on aging through our statewide info line, 1-800-510-2020 if you're seeking meals. But again, look at the numbers. If you go to the next slide, what you see there is what the Families First and CARES Act powered us to do in terms of meals per week from the network, still remaining quite high, 652, 686, 680, 101,000 meals per week. And of course, this is in addition to other food relief provided by Great Plates or CalFresh or food banks, but from the Older Adults, Older Americans Act programs, we've added and increased the service significantly. Another place that we added services was the deep concern about isolation. As many of you know, the Friendship Line was stood up, and again, a partnership. Thank goodness the Institute on Aging already had this service existing in the Bay Area, so we could expand it quickly statewide. 52,658 calls received since April. This was an emergency funding contract, so through December. You may have seen on Monday, the new RFP went out seeking to do an RFP process to continue these services of a behavioral health crisis line for older adults, a friendship line type service into 2021. So please help us circulate and promote that RFP. And we're looking again to expand language access to continue to improve those services. And this is available to all of us, 1-888-670-1360. Please don't hesitate to use this number, call this number. If you are feeling lonely or low, just need someone to chat, it's for us, so please use it. And again, there's the call volume for you. It's stayed pretty steady, about 1,800 calls there in that friendship line a week. So, 300 to 400 a day of people calling from across the state. And we have that numbers by county too, if you're ever interested to see, as we continue to promote and encourage full statewide access. So in addition to meals and preventing isolation, of course, we have our home and community-based services. And we are very thrilled to tell you that our adult day, known as community-based adult services here in California, of course, immediately had to reinvent and redesign and go beyond the walls to deliver temporary alternative services, things like telephone service, virtual health service, delivery services. And this has been a deep partnership with the Department of Healthcare Services. We're so grateful for that person-centered innovation. And it was formally approved by our federal partner, CMS, October 9th, hot off the presses, and remains effective through at least March 12th. That's our current approval. So great news and great appreciation to all that is happening in adult day health. Also want to lift up another home and community-based program, the Multi-Purpose Senior Services Program, helping older folks with more significant health conditions stay in their home and avoid institutionalization. And again, the same reinvention and innovation to do virtual care and meet the moment in other ways. Two really wonderful things I want to share with you on the next slide. Example of terrific state and local partnership. As you know, we have, as a state, and our governor has charged us to deepen our partnerships in the Central Valley, given the impact of COVID there. And when we did reach out, we saw an opportunity to partner with local MSP in 2 counties to help with assessments and enrollment to make sure we were fully leveraging MSSP, using all capacity for people who needed it. And because of those 2 nurses from CDA and the partnership with the local, able to get those enrollment numbers back to where they can be. So just a terrific partnership. And I want to thank everyone involved with really getting to work to serve people. And what I want to just also share, it's very preliminary, but we are just looking at our MSSP numbers. And it does not appear that in the MSP participants, there have been any excess deaths of participants this year compared to the last 2 years, which would be truly extraordinary since this population is highly at risk given their underlying health conditions and age. But it's very intriguing to look into more. At this point, very preliminary, very early, 7 months into the pandemic, not seeing any increases in deaths in this population compared to prior years. So promising research to do there. New work we've told you about in the past. Digital divide has also advanced this quarter in 2 ways. We are very grateful to the governor for the executive order in August calling for a new broadband strategy statewide. The Department of Technology, of course, is the leader. And 2 departments are named, 2 non-technology departments are named CDE, Department of Education, and CDA, Department of Aging, which just really reflects the cross-generation, whole family, whole community approach. We are all going to get online together, even if we may use different devices, need different support. that kind of whole family, whole generation, cross-generation approach is just welcome. And so we are working with CDT now on needs assessment and strategies for that new broadband strategy for the state. And we are also working with our local partners on Older Americans Act. This is one of the areas where we want to do shared services and pool our funding across the state to get more devices out and more support. So that is well underway. Great development of the program elements, a significant work underway with work groups with the AAAs and others, and more to come. I hope next quarter to have some numbers and stories to share about those devices actually getting out to the community, but really strong work in flight there. And just a reminder, we continue to promote resources of partners in this area, as well as I think we all know, being online is so key to weathering this staying at home, whether it's the virtual health, whether it's the connection to loved ones, ordering groceries and other essential supplies, attending religious services or other meaningful community connections. So please take advantage of resources from San Diego Oasis and San Francisco Tech Council and so many more to get online, and stay connected. And last in our program updates, we are deepening our focus on equity in a number of ways. Since we last talked to you, we have issued equity guidance with our CARES funding to our AAAs that was deeply rooted in the equity tool developed by the equity work group of the Master Plan for Aging. So that equity guidance is encouraging and supporting and assisting our network to ensure that our Older Americans Act funding is being spent in a way that advances equity, addresses longstanding discrimination, and really is moving us to a California for all. A second step in that, in addition to that program guidance on equity, is lifting up peer-to-peer training by providers who are already excelling in this area. So we are kicking off an equity and aging webinar series, peer-to-peer, by providers, for providers, by advocates, for advocates. It launches November 4th, first Wednesday from 10 to 11. We are so delighted. The first topic will be Native American elders, and we have April McGill of the California Consortium for Urban Health and Corey Novak of the Toyabe Indian Health Project and Master Plan Equity Work Group, who will be leading that session. And then in December, we will be looking at disability and aging, and Anna Acton and Christina Mills will be our peer-to-peer trainers and leaders, and more to come throughout 2021. So join us, and if you should be getting announcements from our Together We Engage and CDA emails, but please do save the date, more to come. Okay, in addition to all of our programs, and provider networks, we also provide a public information to all who are aging, whether or not they receive a particular program, all people with disabilities and all families, caregivers. And of course, the need for public information around aging and disability and staying healthy and staying connected, it's got to be at an all-time high. So just wanted to share some of the work we're doing to continue to grow our reach and impact in this area. I've mentioned some of our phone lines, the California Aging and Adult Information Line, how we've upgraded the technology and our partnership with AAAs. I should say taken the first steps, but this is a good one-stop number to get you connected to your local community, and we have more plans ahead. We'll also be talking about our health insurance counseling and advocacy program with their particular Medicare expertise. I've already mentioned the friendship line and of course the crisis line to call for long-term care ombuds. These are four of the lines that we have in focus. I'll talk a little bit about the Aging and Disability Resource Connection emerging in some communities, but at this point, these are our statewide numbers. Next slide will show you how information continues to be a high volume for us, new highs, and we're pleased that more and more are being routed to the locals and answered and responded to, so that continues to be a priority. Here's something that's interesting, the high cap calls, the next slide, the Medicare counseling calls, while steady and of course rising as we approach open enrollment, are lower than we all think the need is and the possible potential for service is. So we'll talk more about that too in a second, what some of the plans are, but continues to be a place where people need guidance and assistance for sure. And then again, the ombuds line, the crisis line continues to also be answered. Even while we work to re-enter, the telephone is often the first point of contact for families, for residents, for staff, all seeking help. In addition to telephone, we also, the mail remains one of our ways to reach people. And again, we are able to piggyback on a state mailing to all Medi-Cal recipients and provide these resources across multiple services, whether it is medical assistance or abuse and neglect in the home or fraud, the AARP Fraud Watch hotline. And again, this would not be happening without the deep partnership with AARP to help us design and create this resource, and with our partners at DHCS to send it out. And you know, it's been a very full quarter. Lots of information assistance needed to help people stay safe and connected. So disasters, really rounded up our disaster information and pushed that out, shared that out to our providers and the public. And to other resources. Oh, I should have mentioned on disaster, of course, key partner, Office of Emergency Services, and Vance Taylor in particular with the access and functional needs leadership that he provides. And then here we are on voting. I don't think I need to tell anyone, but I will have that plan. Do that master plan to vote and vote safely, and check in on your friends and family. We were thrilled to do a webinar, town hall actually, with the Secretary of State and AARP, again, making sure older voters continue to lead the way in voter participation and turnout, even in a time of new public health restrictions. And again, helping folks publicize getting your flu shot. A little different this year with the stay at home, but still essential and still possible, and promoting that campaign as well. I'm going to give you the littlest of sneak previews to something that is still under development. We have been very pleased to be getting the guidance and counsel from California State Librarian Greg Lucas and his team about how we can help our check-in calls really turn into connections and hear the stories of older Californians' struggles, resilience, loss, and triumphs. Older Californians' long lives have seen hard times, have seen challenges, and their lessons of losses and also of growth, of resilience, can be very inspiring for all of us to hear them, and can also remind them of their own strength and resilience and purpose. And so hoping that we can make this a real touch point for families and generations and friends gathering virtually over the holidays to just deepen that connection and create some wonderful California history from our elders. More to come. I see one question in the chat about will these slides be posted, and they absolutely will. So thank you very much. We'll get some more questions as well. So master plan for aging. We are at a very exciting time on the timeline, so I'll run through that, but then also just some key points about how it's all coming together. Here's our timeline. Believe it or not, we're in that last orange bar on the right. June to September 2020, all public input and SAC recommendations have been submitted, including COVID lessons learned. That's how we spent the last 3 months since we've been together. And now we are working with the cabinet work group to finalize that into a master plan, still on track for December release at this point. What will be released in December? A state plan, to be clear, for partnership, for state and local government, for communities, for organizations, for philanthropy, for private sector, really bold goals and concrete actions that we can all take wherever we sit. It'll also be a local playbook. It's critical to us not only that we build on the work of counties and communities that have plans for aging, like Los Angeles, Purposeful Aging, and like Age Well San Diego, but also help other communities join the movement and make plans that work for them, that work, build on those lessons and experience, but also work and reflect your community's values and priorities and capacity. And then critically, a data dashboard on aging, which will track those bold goals and our progress towards them. It will be a 1.0 version, like all of our dashboards, continuous improvement, but one of the California Department of Public Health that will be hosting and is building the dashboard, and West Health Foundation, who has supported extraordinarily the development of this 1.0 version of our data dashboard. For all you want to know, we do have a progress report that was posted a couple of weeks ago with everything that happened this summer, which has much more detail. So please refer you to that. But a couple highlights. We couldn't wait to kick off the anti-ageism work. One of the things we heard loud and clear in our surveys of the public, next slide, and in our stakeholder meetings and our equity work group meetings, where that ageism, the pandemic, and that we needed to call it out head on. We were fortunate to host a town hall on ageism with leaders from our field, including Shireen McSpadden in San Francisco and MetaFund, another one of our core funders, pulled together some resources on the equity and aging, and again, really began to push out the guidance, the tools, really looking at the intersectionality of ageism, as well as racism, ableism, homophobia, sexism, and more, to make sure that really work didn't wait and will continue. The stakeholders came through, had a very, very busy and productive collaborative summer. Our stakeholder advisory committee of 33 of California's leading experts produced an executive summary that called out to the state to work in 5 core areas: equity, the system of long-term services and supports, housing, addressing again how aging can be a time of thriving, a time of joy, a time of connection. All of those pieces were the priorities that the stakeholders lifted up, and behind that, more than 800 recommendations. All of those are available on the agency MPA webpage. Came in about 7 different reports from the different work groups, the goal work groups, the LTSS subcommittee, the research subcommittee, the equity work group. And there also were some cross-cutting proposals. We just need to lift up, of course, climate change and the impact. So, many of the people dying from the wildfires are older people, and of course, it's some change movement. Technology, David Linderman, about how technology is changing aging. Proposals for new university research consortium. And there's even more. We are particularly delighted for a special partnership that we now have by along with Maria Shriver, our former first lady, and Alzheimer's advocate extraordinaire, in a master plan for aging work, so that we are both moving in the same. Those will be coming forward very shortly in November, and we're just pleased to be working deeply with them. Susan Damaris is on both, and so we want to thank her for continuing to help build those bridges and help us stay aligned and be bold together. And the very last public stakeholder engagement we had was in September with Assemblymember Jim Wood. We were so grateful to have the chance to reschedule our roundtable. We had hoped to be in person in Humboldt in Eureka in April, but we went with Plan B and did virtual. And you can see Jim Wood from his screen, Secretary Galley. I hope you can also see Maggie Kraft, our aging leader, and Holcomb, the food bank leader, but a really great conversation about connecting health and housing, as you can see on the agenda. I had really how housing is health and health is housing. So a wonderful way to bring a lot of things, and grateful to the partnership with Jim. Okay. We want to run through a couple of other key pieces for CDA. Just want to call your, again, more work with the legislature. Despite being an unprecedented and different session for many of us who've worked around the Capitol, legislative attention remained on older Californians and aging, and just want to lift up a few of many bills. We do have all the bills on aging posted, but want to just lift up some member Calderon's focus on it, and we're thrilled to dig in on the affordability of law issues. And again, an increasing issue to work deeply with our AAA network and others on mental health. And again, Assemblymember Wood keeping our focus laser on COVID and people who are dying, and particularly the intersection with skilled nursing facilities. So lots of great work by the legislature and lots more good work to come. I also want to thank the many of you who are joining us in continuing and new ways. I want to lift up the Aging and Disability Resource Connection. We have reconstituted, had their first kickoff meeting last day before. Next slide, please. Just want you to all see who has agreed to serve on the Aging and Disability Resource Connection Advisory Committee. Anna Acton, Eric Crutcher, Jacqueline Jackson, Connie Jones, Victoria Jump, Jewel Lee, Jan Lamucci, Kristen Loomis, Helen Lopez, Gregory Mathis, Brenda Schmidhenner, Kate Shadowan, Jeff Tom, David Wilder, and Letty Zuno. We had a huge applicant pool, so it was tough. So thank you to all of you who see the opportunity here. We have really charged this group to build on what has been done, but also really hear the public's call for a need to have an easier way to get information, to get connected, to get care coordination on aging and disability services. So how can we really lean in and take this vision? What would it take to get California to a true statewide one-door system? So thank you to the committee for answering that charge, and look forward to the planning work to come. And then also have to acknowledge our governor's work to continue to support the California Commission on Aging, our partner under Carol Schwartzlander's leadership and Chair Betsy Butler. As you can see on this slide, 3 reappointments: Joaquin Angera, Mia Kong, Sedalia Sanders, and some new appointments: Erica Castile, Annie Chung, Brendalyn Goodall, and Faisal. I'm not sure how to pronounce Faisal's name, so I will apologize in advance. Faisal Kazi, thank you. And we would be remiss if we did not say thank you for your service to commissioners who have been tremendous in partnering with us in this master plan for aging process, and some who have served for many years with their particular expertise from their communities and their lived experience in their profession: Ed Walsh, Stuart Greenbaum, and Jane Rosansky. Thank you to the commission. Okay. We want to finish with just giving a little bit of CDA internal departments. We won't spend too much time here, but this is what happens behind, which we hope then results in the person-centered service to the community, to the state, and to our providers. So you heard last time about our strategic plan. This has been led by our Chief Deputy, Mark Beckley, and I'm so grateful to his work. We are emerging from COVID clear that our vision is to transform aging, and our mission is to be innovative in programs, planning, and partnership to increase choices, equity, and well-being. We are committed to being person-centered and outcome-based, to both leadership and collaboration, to be innovative and inclusive. I want to spend a minute on these 5 goals just so you're clear on who is leading each of them. We have 5 strategic goals. First, lead the governor's master plan for aging. Amanda Lawrence is our project director. Our second goal is quality services that increase our choices to live at home and community as we age. And of course, Irene Walela is our program deputy. Our third goal is to deliver quality service that increase the well-being of residents in California's nursing homes and other senior living facilities. And that's led by the state's long-term care ombudsman, Joe Rodriguez. 4, engage the public around age. I'm so grateful to Adam Willoughby, who is doing double duty as both our Ledge Director and Comms Director. And we are thrilled to report that we had, once again, a robust number of applicants for the new position of Communications Director at CDA, and are working through that process, and hope to, next time we talk, be able to introduce a Communications Director to you as well. So that's in progress and an exciting piece. And then the fifth, all of this only happens if we can modernize CDA for our public partners and employees. And our admin deputy, Thomas Cameron, has been an extraordinary leader and hard worker in this area. So want to make sure you know who our team is, and we'll hear from them more in the Q&A as we need to. Now, what I want to show you next is just a preview of some of the initiatives that are going to drive those goals. This is not comprehensive, and we'll be posting a more comprehensive list in coming weeks. But here are some of the initiatives that are being prioritized. So Master Plan for Aging implementation. As I often say, the work really begins in December when the administration's plan is released. Medicare counseling. We know there's more we can do with HICAP to reach more and serve more, and have had some great initial conversations with the association and the providers and our staff team here to be thinking about what would that look like to really bring HICAP forward with marketing and technology and service and training to serve more people navigating the confusing world, sometimes confusing world of Medicare. I already mentioned the ADRC planning. How do we get to statewide service? I'll talk in a second about the Older Americans Act state plan, which is in flight. We also really need to invest in a enterprise client relationship management system. We are in a range of different systems, and it makes it harder for our local providers. It makes it harder for all of us to see how we're doing. And of course, that's what it's about, is data for action and transparency through data dashboards. Teams are already working to streamline monitoring. That was in flight before COVID, but certainly now that we're going virtual, that is accelerating. Again, huge thanks to our admin team taking a fresh look at fiscal, contracting, and auditing as one example. Our federal COVID money we were able to give out with allocation and not contract amendments. And we want to move in that direction again to provide absolutely rock solid oversight, but a more expedited and modern way to be in fiscal relationship with our local partners. A key priority is our CDA has joined training on equity, particularly around race and racism. We are part of the Capital Cohort on the Government Alliance on Race and Equity, a year-long training plan. Already it's producing some, we brought back some all-staff training on implicit bias. And the GARE team, the Diversity, Equity, and Inclusion Plan for us. So that is across administration. But I would be, I don't want to go any further without taking a moment to acknowledge our staff at this time. They have overnight gone to working remotely. They are navigating COVID both professionally and personally in so many ways. They are, of course, adjusting to the furloughs necessitated by the economic contraction, and yet the work continues. And really, we wouldn't be able to do any of the ongoing work, much less take on this new work, without both their commitment to the work, their commitment to each other, and the commitment to all of you. So it's an extraordinary time. We're all challenged in how we support people working remotely, staying connected without that coffee break together or walk. We used to take staff walks, and so we're having to find new ways to be a team, but we're doing it. And I just want to thank the staff. None of these slides would be possible without working through the challenges. So a couple have the master plan in flight, and we have our strategic plan in flight, but a key bedrock plan for the department is the Older Americans Act required state plan every 4 years by the feds. You see on your screen a visual of the one that my predecessor, Laura Connolly, did with Secretary Dooley and Governor Brown, that this goes up to the feds and is a deep collaborative planning process that sets the course for the Older Americans Act programs. You can see there kind of 3 milestones. The local plans all came in this summer. We of course gave people an extension given the COVID response, but thank you to the local AAAs for the deep work of having those hearings, talking to your community, assessing needs, strategically thinking and sending in your plans. We will be having public hearings in the new year, and then finalizing our state Older Americans Act plan to the feds in the spring. Some initial common themes from local area plans that we've been analyzing. Here are some of the priorities. Better access to information, services, and resources. You hear that common theme a lot, whether we're talking about HICAP or ADRC or public campaigns. The public needs more information. More services to help people age where they choose. This issue around isolation and engagement, opportunities to work, to volunteer, to serve, to participate, combating ageism. Fourth one, coordination, collaboration, and planning among the many programs and agencies. How do we structure our system so it's easier for people? The burden's on us, not on them, to navigate our services. And again, supporting the health and well-being of older adults, people with disabilities, and caregivers. From the state perspective, here's what we are seeing as trends to merge in with the local trends, obviously responding to the COVID needs, continuing day-to-day right in front of us, as well as the lessons go forward. Then this interesting opportunity, how do we implement the master plan for aging in a way that leverages the Older Americans Act services and roles, the historic, traditional, central, catalytic role of aging state and local departments in being that leader and partner? How do we bring those things together? Third, equity. Older Americans Act programs have always prioritized, are open to all income, but prioritizing people of highest needs, and how do we continue to update that, deepen that, grow that to advance equity? And then this theme of leadership, looking at how our aging leadership and partnership structure is currently established. The original blueprint goes back to about 1980. And it really has three elements. It divides the state into 33 planning and service areas, PSA. You might hear sometimes in AAA speak, PSA 2 or PSA 25. There's an interstate funding formulas, plural actually, a couple different parts of it that as you can imagine, allocate the money. And then there's the question of local government and state government designating the lead area agency on aging within each PSA. And so over time and historically, there have been a range of ways this has worked out. We've got everything from multi-county JPAs, we have single county, we have nonprofit leads, we have government leads, and within government, we have aging in different places. So this has been a hot topic recently, and I want to just commend LA County and LA City for leading the way. They are looking at this question. LA County and LA City have two AAAs, two PSAs, and so their Board of Supervisors has directed them this summer to look at creating a combined and standalone independent aging and adult department. And so LA County is beginning that process of assessment and examination, and we are learning from them as well as from other communities around the state and the country. So more to come on that. We'll be at questions in a couple minutes, so keep them coming. Just want to remind folks, we are still planning to move our physical building to Gateway Oaks to join more of a more user-friendly for our visitors, particularly older and people with disability, lots of accessibility and parking, and also for our staff. We've got some basic health and safety issues at our current building, so we need to remedy those and get to a place that is supportive for, again, partners and our staff. Anything I haven't covered or anything you want more detail on is probably in our most recent newsletter, Aging Matters. I commend it to you. And welcome feedback on that at any time as well. Okay, you heard from me. I would like to hear, see, there's the contact email, one of the questions. There is, how do we contact you with feedback or questions? And we have the email address for our communications, OLPA, Office of Legislation and Public Affairs. Like I said, it's currently a combined office, olpa@aging.ca.gov. And Adam and our team will follow up. Okay, team, how do we want to work through the questions?
Great. So again, if folks have questions, please hit the raise hand icon in the bottom left hand corner of your Zoom screen. If you're calling in, press *9 and our team will unmute you to ask questions. Please be brief and we will try and get through as many questions as we can. So Maria, do we have someone queued up to ask a question?
Thanks. We've got a couple of folks. First, we're going to start with Rose Marie. Rose, your line has been open.
Thank you very much. I'm from San Diego, and I would like to know who to contact about the ADRC and how the ADRC is funded under the new Older Americans Act, and who is working on that on the state level?
Great. You can contact us at that email. Wilson Tam is our lead for ADRC. He works with Irene Walela, our program deputy, but if you send an email to OLPA and put ADRC in the subject line or the message, we'll connect you with our team. And I see there's some questions coming in about funding about that similar. I'm not following the question about why did the CDA lose funding? We did not lose funding for ADRC. We continue to have both state and federal funds that we are putting towards that growth in services. So if you want to clarify or follow up, please do reach out so we can do that.
Thank you.
Thank you. Our next comment is from Jeffrey. Jeffrey, your line's been open.
Yes, Kim, this is Jeffrey Tartagia. Two questions. One of them, I've heard that dealing with the inspectors for dealing with nurse care facilities, there'd been a recommendation to be more cooperative. It seems to me that's more of the omnibus's role dealing with the agency, because the inspectors seem to really don't want to be making judgments of nursing calls and then telling them what they need to correct and do. That is question number one. The second question is, will you mention about the broadband? You offered it. I know that there's an effort going on in Yolo County, and there's some other efforts going on about increasing. And today's call, I could clearly hear where there's an increased need, because in some of the incidences on the Zoom call, your speech got lost. It just went into the thing, which fortunately there was not that many on video that assisted that, but they are going to be doing end-to-end encryption, which is another layer. And unfortunately, you don't have a communication official yet with you. And that's as brief as I can make it about the two big concerns of what's going forward. And the third one would be the Meals on Wheels and what you intend on directing with the lack of social programming, where you'd make that other effort to get the, shall we say, loneliness and isolation that is a primary factor that's becoming of the results of this COVID-19. And yeah, Kim, I asked too much.
No, thank you, Jeff. And you're right on target asking about digital divide. I am working from home and my internet is out today. So I am coming to you by cellular. So I hear you on the digital divide challenges and limitations. So let me just start with that. Yes, we know there's broadband access issues, device issues, support issues. And I see in the question, there's also, administrative issues about how we manage stock in a way that is both and doable. There's tracking that we are working through, that intersection between program realities and administration requirements. So that is a work in progress and a challenge. Part of why it's we might have wanted to have the devices out sooner, but we are working through some tough admin issues on that. And yes, part of why the devices are so important is to provide some of that content. I don't know if you were at the SCAN Foundation conference earlier this week and seeing Catherine Louie taking exercise class online and attending her congregation online. But you're right, phone calls and virtual and doorstop. I'm seeing our Adult Day Health Center in the East Bay delivering goodies, fall treats to folks. So people are really having to be innovative, because you're right, our meals programs have always been about way more than food. And we don't want to lose that even as we keep the nutrition needs met. I don't want to lose your nursing home question. This question, yes, there's been a lot of change and innovation from my colleagues at CDPH, led by Heidi Steinecker, in the nursing home response to get a handle on infection control. And so there's a lot in progress. Jeffrey, I would encourage you to, if you have written comments, or if there's another, there are certainly stakeholder calls happening to give CDPH that input about the role of the surveyors. It's definitely a work in progress, and that dialogue continues. So input welcome, and let me know if I can help connect you to CDPH to have a direct connection on that.
Our next
There's a
talk-
couple nutrition questions. I could just, one of the questions that came in, I see in the written is about nutrition. And I can only attest that, yes, there were, where will nutrition be in the master plan? I can only attest that there were many nutrition recommendations from stakeholders that are being digested now. Some on the programs that we've talked about just now, some on the new Great Plates program. I see in the questions, it's been challenging with the month by month extension. That's definitely a function of the emergency dynamic, but incredibly challenged for day-to-day operations. So understand that challenge, but what could Great Plates 2.0 look like? I've heard some of you having conversations and recommendations around that. But there's also, and of course, the traditional hunger programs, CalFresh and food banks, but there's also interesting conversations around the role of nutrition in health, both medically tailored meals and also potentially in lieu of service in nutrition and health, we all know. And then I think also, acknowledging how do we continue to expand residential opportunities that have meals included as one of the ways to address nutrition, and increasingly technology solutions that are helping to monitor nutrition, wearable technology and refrigerator technology. So a whole range of nutrition related recommendations have been received and are being assessed. Thanks, Maria. What's next?
Thanks, Kim. Next we have Wesley. Wesley, it looks like you're using an older version of Zoom, which won't allow us to unmute you. So I apologize about that, but please feel free to type your question or comment into the Q&A. And we'll move on to
and I see about 3 or 4 questions from Wesley. I think we've hit on a couple. Let me just talk about 2. One is, how will you assess your outcomes in reaching Black and Indigenous and people of color? And this is a huge part of our data dashboard, is making sure that our goals are about closing equity disparities. We're inspired very much by the agency's recent release of the COVID indicators by counties that also have to close the gap within the county so that there are not widespread disparities in the presence of COVID. So that is certainly a touchstone inspiration. And then of course, CDPH's longtime work in race, and to the extent available, LGBTQ data, disability data, country of origin, language. There's lots that we are baking into that dashboard to hold ourselves accountable as a state and as communities to make equity in aging, to drive equity in aging and remedy past discrimination. You also have a question about our oversight. We do have oversight responsibilities. We've talked a lot about funding and technical assistance and peer-to-peer support, but absolutely we do oversight. We do monitoring for compliance and respond to complaints on an ongoing basis. And if you have any specific questions, I urge you to use that, use the email, the OLPA email, to contact us, and we can connect on that issue as well.
Thank you, Kim. I appreciate you jumping in. Holly Hagler. Holly, your line is open.
Thank you. Kim, actually, I already had put my questions in the Zoom box. So she addressed that, although I do have a question on Great Plates. And I know that there's this nature of the, this last minute extensions because of FEMA. But one question that keeps coming up is, will the state determine at what point it's going to stop seeking the renewals, and maybe so it can give like a 30-day notification period, that kind of thing.
That is a great suggestion. I will be happy to route that to our OES Office of Emergency Service colleagues if they don't already have it, or if you, but I can certainly pass that forward. Appreciate that.
Yeah. And then the other part is, and I imagine this is part of the discussions, I know it certainly is at the ACL level, and that is the serving levels are extremely high for all of the nutrition programs, and especially the Older Americans Act nutrition programs. And just the pervasive question in the network, and I'm representing Meals on Wheels California, I sit on that board as well, is that what, if anything, is going to be addressed, additional funding, what have you, relative to supporting these high serving levels, because the crisis has brought to the fore so many people who actually were struggling with food insecurity before, but hadn't connected with resources. And now that they're connected, even post-COVID, the numbers and the demand is going to be substantially higher. And I didn't know if the state was engaging in those conversations, or if it's more of you see that more of a federal issue in terms of addressing the, funding for that.
Yeah, I mean, there's certainly the awareness is very high that while there has been a significant infusion of funds through Families First and CARES, formally that goes away next September 30th, so less than a year from now. And more practically, many communities have already or are well on their way towards exhausting those funds well in advance of next September. So I think that's part of what the dashboard is hoping to tell the story about the deeper need, the broader need, the ongoing need. But yes, I often say on calls now, the crystal ball on federal funding is broken. I don't know when to, we will hopefully get more clarity in a couple weeks, and a couple more weeks, and a couple more weeks, and a couple more weeks. So I think the federal question of what additional stimulus, is top of mind for everybody. And then of course the state budget process begins in January with the governor's proposals, and that's deeply influenced by the current climate and the challenges. So I don't want to be either overly optimistic or overly pessimistic. It's just really unknown right now. But it's the issue of the need and the ending of the current COVID funding as we currently stand is very clear to people, but can always be raised even more and further.
Thank you.
And Kim, I don't see anybody else with their hand raised, although there are still a couple of questions in chat if we have time.
Yeah, so I think a bunch of them we'll do follow up on. So there's a question from Krista Barrett Nelson about posting standard agreements we'll follow up on. There's questions about yes, everybody is eager for the digital divide to get rolling. We share that eagerness. So yes, that more information will be provided around that, more guidance will be provided around that coming. That is one of our top priorities, to use those funds and to help people get connected. So we hear you loud and clear on that prioritization. And I guess I think it's actually appropriate that Ms. Cleo raises, well, what about our homeless aging citizens? This is absolutely top of mind. I believe it's one of the top subjects that we addressed in our Wednesday webinars pre-COVID with Dr. Margot Kuchel, and of course the Department of Social Services in their work with Project Room Key, and now to Home Key is serving many, many elders. And I hope people saw the recent New York Times magazine about homelessness over 50 will triple in the next decade if we don't address it. So I am pleased to see that so much of the stakeholders recommended and prioritized housing and health and isolation, that we have to address all of those in a combined community solution. And I know we're taking that forward to the cabinet very seriously. So more, again, more has been done than ever before, but more is needed. So thank you for bringing those urgent stories. Janie Castillo from St. Mary's Center in Oakland has been a incredible and invaluable champion of those voices, and we hear them and know there's a lot more to do. I think with that, we're at time, and we will take, I see some more questions for historic data, corresponding data from Tom. So please, we will take that, Adam, and follow up with people, slide them to our regular, our leads in those areas, and get back to people in due time. With that, thank you to everyone for the conversation, for the feedback, for the challenges, and most of all for the partnership. Please stay safe, stay connected, and thank you.